Good afternoon, and welcome to today's session with the Navajo Nation OPVP and the Department of Health Lunch and Learn. My name is Commander Erica Harker, and I am the IHS Navajo Area Pharmacy Consultant. I have been a pharmacist since 2007 and have served as an officer since 2008. I'm very honored to be here and be able to present today's presentation on a brief overview of opioids and common signs and symptoms of opioid overdose. And I'll also be able to provide information on the life-saving opioid overdose reversal medication, Naloxone. Today, we'll discuss some key words and key definitions. We'll learn about how naloxone works to save lives and where you can obtain naloxone. But first, let's go over the meaning of key words. Opioids. Opioids come from the opium plant and are a class of drugs that are legal prescription medications or illegal drugs. An example of prescription opioid medication is hydrocodone, morphine, codeine, oxycodone, fentanyl. Opioids can also help treat substance use disorders such as buprenorphine or Suboxone or methadone. These medications are followed closely by a healthcare provider at the clinic or the hospital. Prescription opioid medications are made in pharmaceutical labs. They are closely monitored by stringent laboratory parameters. Then there are illegal drugs that are not made in the lab, that is not as highly regulated. They are made illegally outside of a lab, such as heroin or illegally made fentanyl. Some examples of illegally made fentanyl is something you might have heard or seen in the news, like rainbow fentanyl. Rainbow fentanyl looks very colorful, looks very deceiving like candy, but is very harmful and can lead to an overdose. What is an overdose? An overdose is a sudden and severe or acute condition resulting from an excessive amount of opioid being swallowed, inhaled, injected, or absorbed through the skin, intentionally or unintentionally, leading to possible death. Naloxone, also known as Narcan, is a life-saving medication that can reverse an opioid from all types of opioids, including heroin, fentanyl, and many other prescription medications we just mentioned. Our next topic talks about why it is important we learn about naloxone. We are learning about naloxone or Narcan because it is essential. It's an essential tool to save a life. Unfortunately, anyone can experience an overdose. We all make mistakes, and sometimes we grab the wrong medication or misread instructions. Sometimes family members may not know they are at a higher risk of an overdose, like if they have a chronic health condition like COPD. There is a great deal of stigma around persons with substance use disorder or SUD. This may stem from the belief that substance use disorder is a personal choice or a moral failing rather than a chronic, treatable disease from which patients can recover and continue to lead healthy lives. This stigma also contributes to negative attitudes towards naloxone and the false belief that naloxone is only needed for persons with opioid use disorder. This continues to be a major barrier to naloxone distribution and harm reduction efforts to prevent opioid overdose. Unfortunately, did you know that American Indian and Alaska Natives overdose rates have increased by almost 40% since 2019 to 2020? The CDC has reported that American Indians and Alaska Native minority group has the highest rate of death in overdoses as compared to other races and ethnicity. Unfortunately, some of these conditions in the places where we live, work, are wide in disparities because we live in some very rural areas. And in some rural areas, they have higher rates of overdose deaths. And it is why it's very important to learn about this so we can help prevent overdoses. What is an overdose? As we talked about it in the last slide, overdose can unfortunately occur in anyone. There are accidents. We should learn from what happens during an overdose. In an overdose, opioids, whether they are prescription or illegal opioids, can suppress the urge to breathe. It slows the breathing down. Breathing is important for our body because breathing helps us take in oxygen. Oxygen helps our brain to function and helps bring nutrients to our organs so we can continue. But when breathing slows down and when breathing stops, carbon dioxide levels can increase, and the process can take time. But once you stop breathing, that can cause brain damage and eventually lead to your heart stopping and potentially death. So every minute, every moment is important, and it's why it's important to have naloxone. Who is at risk? There is unfortunately a few individuals that are higher risk for opioid overdose as compared to a person who is healthy. People who are at risk are curious young children. Our elders are at risk. Individuals that have chronic health conditions such as chronic obstructive pulmonary disease or COPD. If individuals have breathing issues like asthma, sleep apnea, or dementia, people who have a history of substance use disorder, people who are using intravenous medications. Other things are individuals who recently were getting treated in a drug treatment program or recently released from jail, or if they've had a history of substance use disorder. These are the individuals who are at higher risk for substance use disorder. How do we know and how do we recognize an overdose if it is happening? These are the common signs and symptoms of what happens in an overdose, and it is important to recognize these common signs and symptoms. And they are listed there on the slide. You can see that there's a temperature gauge. A temperature gauge is signaling that the person may be cold or clammy to touch. There is an ear there, and that represents you may be listening or hearing gurgling sounds or choking sounds, or they might sound like they are snoring. There's also a picture there of two eyes with pinpoint pupils. That is a common sign in an individual. You can also see there are blue lips and blue hands, which is a sign for blue lips or blue fingertips, because that is common to see in an individual who's overdosing. You'll see the lung there. The lung picture is signifying a person who may have shallow, slow breathing, or their breathing may have stopped. And then there's a picture of a heart there. The heart there signifies how the blood pressure may be low, or the heart rate is very low, or you may not hear the heart rate anymore. And then there is a picture of like somebody sleeping, where the person that represents a person that's having an overdose would be unresponsive. They're hard to wake up. You try to shout and you try to wake them up, but you cannot arouse them from waking up. Their body may be limp. In addition to that, those are the common signs and symptoms in an overdose. And it's important to recognize these, because in the event that you recognize these signs and symptoms, we can use the life-saving medication called naloxone. What is naloxone? Naloxone is a life-saving medication that can be given as a nasal spray. It reverses overdoses from all types of opioids, such as heroin, fentanyl, both prescription and illegal drugs. It can reverse those opioids. It can be given even if you're not sure of what a person is overdosing on. The safety profile of naloxone is so safe that it has gone over the counter. It works very quickly. It works within 1 to 3 minutes and can stay in the body for up to 30 to 90 minutes. You'll see here on the slide, there's little lightning bolts. Those lightning bolts are like antennas. They are receptors throughout our brain that work with opioids and naloxone. The round blue ball there on the slide is an example of an opioid, and the N is naloxone. The star N is naloxone. When a person has an overdose, the body will signal the opioids to those receptors, to those antennas in the brain, and cause the overdose, cause the slow breathing, cause the heart to slow down. But the life-saving naloxone medication comes into the body through the nasal spray and can work very quickly and has a stronger attraction to those opioid receptors, or those antennas, those little lightning bolts there. It can come and kick off the opioids and sit on that receptor or antenna right there, as you see on the right side of the slide. And when it sits there, it kicks off the opioid so the person having the overdose can breathe again and can wake up again. There are several things that we want to debunk about naloxone. There's some myths that are not true about naloxone. We have heard that naloxone encourages drug use or increases the risky behavior, increases addiction, and can be misused. Now, that is a myth. That is not true. In fact, naloxone is non-addictive and does not lead to more or riskier drug use. There are no risks if there is no opioids in the bloodstream. Naloxone has no effect on a person if there's no opioids in their body. Another myth is right in the middle. You'll see in the red box in the middle, naloxone will cause harm. That is a myth. In fact, naloxone is safe to use and can be given to elders, pregnant women, and children. Naloxone nasal spray is safe in all ages and all sizes of people. Naloxone can be given even if you are unsure of what a person is overdosing on. A third myth is only first responders can save a life of a person experiencing an overdose. That is a myth. In fact, bystanders, community members like yourself, can act to prevent an overdose by using naloxone. States such as New Mexico and Arizona have laws. They have Good Samaritan laws that protect individuals that are acting in good faith and honest faith to give naloxone. What agents does naloxone reverse? Naloxone reverses all the opioids listed there on the left side: morphine, codeine, oxycodone, hydrocodone, fentanyl, hydromorphone, oxymorphone, and heroin. Those are the agents that naloxone reverses. However, naloxone does not reverse things such as cocaine, methamphetamines, diazepam, alprazolam, or alcohol. How can you obtain naloxone, and how do you safely store naloxone? Naloxone is available over the counter. However, when you go over the counter, the price of naloxone can sometimes be a bit pricey. Fortunately for our Native American beneficiaries, if you have a chart at any of these IHS facilities in the Navajo area, or even any IHS facility, you can go to the pharmacy and obtain naloxone from the pharmacy. You do not need to make an appointment. You do not have to see a doctor, or you do not have to go through the clinic to get naloxone. You can go to the pharmacies. And here's a listing of all the Navajo area pharmacies that support providing naloxone through the pharmacy. and you're able to obtain your naloxone through the pharmacy. You check in at the front desk, let them know that you would like to receive naloxone as a patient. They'll have you sit and wait for some time, and then they will call you into the counseling room. They will educate you on similar things such as opioid overdose symptoms, and they will also go over the instructions on how to use a naloxone nasal spray. Pharmacists will help educate you and utilize their own local policies to allow you to have that naloxone. It's important when you obtain naloxone from the pharmacy that you take note of the expiration date so that you can replace that before it expires. And also know that if you do use your naloxone, you can return to the pharmacy and request for another. Or if it's damaged, in any event, you can also request for another. Storage of naloxone is very important because with naloxone is a medication, and with medications, you need to store your medications safely and securely. So making sure that you store naloxone nasal spray in the box that it comes and in the carton that it's provided until it's ready for use. Make sure that you protect the naloxone from light. Do not leave it in the vehicle. Right now is summertime. Our vehicles can get very hot and it can cause the medication to degrade. Also, making sure that you take your naloxone in with you. If you put it in your purse or in your bag, take it in with you, so that way it's not exposed to extreme temperatures, because winter is coming pretty soon. Now let's put all of this together. We've learned about some key terms, some definitions. We've learned about an opioid overdose. We've learned about naloxone, and we learned about where to get naloxone and how to store it. And we need to put this all together and recognize that this medication is not harmful if there's no opioids in the bloodstream. Naloxone has a very safe profile, and why it is over the counter. Now, what does over the counter mean? Over the counter means that things such as Tylenol or ibuprofen are found over the counter in Walmart, Walgreens, and you're able to get those over the counter medications without a prescription or without seeing a doctor because they have such a safe profile. Naloxone has a very similar safety profile. Naloxone has no harmful effects in all the years that it has been on the market. And because it is such a safe medication, that is why it is now over the counter. Putting things together again, you can help because when you have naloxone readily available, you're able to give naloxone. Any delay in administering naloxone can lead to injury, can lead to death. And naloxone cannot be used to get high or set someone back in their recovery. Naloxone can be given at any point during an overdose. It quickly works within 1 to 3 minutes and lasts in your body for 30 to 90 minutes. So you have time before help can arrive. Lastly, naloxone has become a standard in many communities, in our communities throughout the country, throughout Indian country. There's no negative health outcomes that have been reported after 40 years of this drug being available. In nearly 40% of overdose deaths, someone else was present. And when someone else is present, having naloxone available and administering has the life-saving benefits in reversing that opioid overdose. There is a video that anyone can view in addition to this lunch and learn session. If you are considering to need a little update, if you visit ihs.gov, you're able to see the video on ihs.gov, and you're able to View other videos on how you can teach others about naloxone. By sharing this video, we expand the education and we expand our knowledge about naloxone. Expanding our education and knowledge about naloxone and common signs and symptoms of opioid overdose is our way so that we can best protect our community.